And this is from the Nairobi Women Hospital's board, which now says the allegations of exploiting patients is false and lacks merit and facts. Now, this is despite evidence in the public domain, as well as the latest blow, which is the Kenya Revenue Authority suspending the institution from its list of service providers. NTV's Silas Apollo reports on the hospital that is under fire.
They say when it rains, it pours, and it seems the rain is hitting hard on the Nairobi Women's Hospital. After 17 insurance firms suspended the hospital from their list of accredited service providers, the taxman has joined the fray. In an internal memo, the Kenya Revenue Authority's Deputy Commissioner of Human Resources, Nelson Mukuria, has asked members of staff to seek medical services at alternative facilities. Mukuria says Nairobi Women's Hospital has been suspended from the KRA list of approved medical service providers with immediate effect. He adds that the suspension stands until the contentious issues between the authority and the hospital are resolved conclusively. The institution has been accused of ripping off patients through, among other things, misdiagnosis, deliberately delaying discharges, as well as unnecessary admissions and tests. But the hospital's founder, Sam Thayer, denies the allegations, arguing that the institution works within the law.
Let me say these allegations are not true. And at the same time say, this is not the Nairobi Women's Hospital board policy. We have our policies, we have our procedures, and we have our processes.
However, this may be seen as a slap in the face of all who have shared their experiences, horrific and agonizing ones at that, experiences which resonate with messages of leaked WhatsApp chats of its Nakuru branch group. This also insinuates that the insurance firms, as well as the Kenya Revenue Authority, have no basis for their suspensions. Some patients have accused the hospital of forcing them to pay cash despite having medical cover.
There are various situations where somebody may be asked to pay more above the insurance, what the insurance or the payer is paying. And one of them would be the insurance tells you, admit patient X or so-and-so. They have a limit of 30,000 shillings. We have no agreement with the insurance company that the bill will be 30,000 shillings. If the bill goes to 35,000 shillings, the insurance company tells us, recover that from the patient.
The allegations have painted what was initially fashioned as a safe haven for victims of gender-based violence as an institution of horror for many vulnerable people. There speaks of the ideal case, the picture painted on the corporate boardroom agreements. The hospital's accusers say what is out of the boardroom and on the ground, as well as in the wards, is different. Silas Apollo, NTV.